Hello, I've come on to talk to you about creating a climate for change, and what that means is transference. So transference is one of the things which is very much important to you and your clients, but it's a subject that isn't really touched upon in any great depth in some trainings. So I thought I'd go through what transference is and how important it is. I was chatting to a student the other day who was talking to me about a situation that she was in, and she wanted just to pass it by me because it touched on certain elements of her own psyche, and she felt a little bit off-footed by it initially. So she agreed that I can share the story because it's an important topic and one which doesn't get talked about very often enough in training. So as we began to chat about her conversation with her test subject that she happened to be working with, it became really apparent to me that what it was that the student was feeling about this particular test subject was transference in the room. And the test subject's own mental state had affected the trainee, their thought processes and what they were saying. And so we chatted about how this can be an extremely useful thing when this happens. I'm always so excited when I sit in front of a client and I can begin to feel their emotions in the room. The trick is to notice when that happens and to use that to the best advantage. In this case, the student said that what the test subject had been saying made her think of her brother, and how when they were growing up things had not been all that good in their household because her father could be harsh or angry. And she said, but I thought I dealt with this, and felt a bit overwhelmed by the feeling. So when I asked, how did it make you feel like you wanted to respond to this person that you were working with, she said it made her want to stop him from feeling so helpless. She wanted to be able to protect him. Now, this told me a huge deal about what was going on in that room at that moment. So over the years I've been a therapist. I've seen lots of different people from lots of different backgrounds and walks of life. And some of them have the same issues as you and I. Some of them have problems with their marriages, some relationship problems, some with their home lives, their school life, their work life, or whatever. And some people have come in and told me things that I have no prior experience to. Sometimes really awful problems or traumas that have severely affected them in some way. But of course, even though those problems that they're bringing are not identical to my own experiences in life, I can empathise with them because I'm human, and we are human in the session, and therefore sometimes what they say will echo ideas or memories or feelings that may have been left buried within me for a very long period of time. I think that there are some things that I've learned over time, and the most valuable thing that I've learned is about the relationship between myself and the client, and that it can be really, really very useful to acknowledge the feeling someone else has in a room, and to notice that you might be feeling it too within yourself. But then notice it's not actually about you or your feelings, it's about them in that moment and their feelings. So in the very early stages of my career, I acknowledge that I wasn't so good at listening or picking up on that transference in the room. I came out of a hypnotherapy sort of training thinking I could resolve somebody else's problems just by suggesting to them to think differently, or that what I said in the session had some influence on the way that they then behaved. And plenty of times I'd have clients come in and they'd say that their mum had told them to do this, or their best friend has told them to do that, or their doctor even have said to them this or that. You know, this is going to sort everything out for you. But it dawned on me that trying to tell somebody anything or give them what you thought was a good idea or advice simply doesn't work. If it did work, none of the people would be with us in the therapy room at all, would they? So I gradually came to recognise that the most valuable help I could give clients was that of the kind of psychological climate that I could provide for them. In fact, the only thing that really mattered to me, it is that kind of professional relationship that I can create with my client. It's a climate of absolute positive regard. These days when someone phones me, I don't immediately think of this technique or that technique that I might be able to use for whatever ailment that they've got. I think, is this somebody I can create the right kind of climate for, so that that sort of transference can take place between me and that person. If I don't feel as though I can provide that climate, I don't take that person into therapy. But then I find somebody more suitable or more able to work with them. And that's a good point. It's okay to pass somebody on who you genuinely can't be 100% genuine with. I had somebody call me once a little while ago for an appointment, and they were calling from a prison actually. And they asked if on their release they could come to see me. And when I asked that person for the reason that they were in prison, they told me they'd been charged with child abduction. Now in my mind, I knew immediately that was one of those examples where I couldn't be 100% genuine in a session with the client. I would have not been able to be empathetic or non-judgmental, so I kindly declined, and gave him the contact details of somebody who would be able to help him. If I'd taken him into therapy, I would have been doing it for the wrong reasons, for selfish reasons actually, and because of my own ego, so thinking I could help anyone and everyone. So I did the right thing. I acknowledged my feelings, and I realised it was better for him if I didn't see him. And I have to be entirely accepting of somebody, who they are, what they've done, to create that right psychological climate. And what do I mean by the psychological climate? Well, it's the kind of relationship and climate that's non-judgmental, where I'm genuine and present, when I'm transparent and I can work safely. And by transparent, what I don't mean is that I'm telling the client my entire life story. Otherwise that would be my own therapy, not theirs. But I am being able to be truthful with the client. So if I pick up on a feeling in the session but I don't quite understand, maybe some anger or sadness or a strange feeling comes into the room, I will highlight that. I'll verbalise it, because I know that in that moment it's hardly ever about me and my feelings. It's usually something to do with the client's feelings, but maybe that's not been verbalised to me. So in being genuine and acknowledging the feelings, the client can then explore what that feeling might mean or what it might represent to them. And this is the art of being able to use transference in the consulting room. The ability to pick up on what the other person is thinking or feeling and feed it back to them. And then that's an incredibly powerful tool. But of course, transference happens both ways. So there's even more reason for me to be genuine with my client, because if I say I'm sat there and you know, say I'm sat there annoyed with them in some way, and I don't often feel anger with clients, but say I do, and I didn't acknowledge it, instead simply shifting into a more kind of professional mask at that point, my client would notice. Now, they may not consciously know why they notice, but it might off-put them in some way, or bring in feelings of not being good enough, or guilt, or any of those feelings, or being naughty, or any of the negative emotions that I may never get to see on the surface, but could potentially damage the therapeutic relationship. So when I hear about the therapist's example, or my student's example, the one where the client had come in and said something that really made the therapist feel some unexpected emotions, I congratulated that student on being an open and a good future therapist, one who recognised fully the feelings in the room, and who also noticed that it touched upon her own history and previous feelings that she might have had. But I encouraged her to work with those feelings and to truly tune into them. So instead of assuming it was about her and about her own childhood, she could use this transference to become a far more effective listener, or a far more effective therapist for that client. The therapist could use what she felt and bring that into the room, because the chances are those feelings were exactly what that client felt, what that test subject felt, but didn't yet recognise. And to actually be able to explore those feelings was a really, really good thing. And to ask the client, what can we collectively do to help you move into a better place with all of this, is also really important, because the client is the best expert in their own life and their own situation, for sure. We might have all the techniques in the world, but techniques on their own mean nothing. The client is the best expert in their own life. So I hope this helps the therapists who are maybe new and just transitioning into the role of being a therapist in the room with somebody. And I really hope that you begin to notice transference in the room whenever you feel it from now on, and use it to your best advantage, to the client's best advantage. Have a fabulous day, all of you. And if you've enjoyed this video, please subscribe to my channel, and you'll see any new ones that come along by doing so. Take care.